Hello, I'm going to be talking about OCD. So let's first of all talk about the characteristics of OCD, which is required for you to know. So the cognitive characteristics of OCD is that you have obsessive thoughts. People make the really big mistake of thinking that obsessive behavior or obsessive thoughts are behavioral. It's not behavioral, it's cognitive, because it's the thoughts that are obsessive, nothing else. So obsession is cognition, so it takes place in your mind. Cognitive coping strategies, insight into excessive anxiety. Behavioral is compulsions are repetitive and they reduce anxiety and avoidance. Some people may avoid, which makes them feel better. Compulsion are repetitive, for example, if you're like, okay, well, you need to wash your hands. You wash your hands, you keep doing it, keep doing it, and it also reduces anxiety. It makes you feel better about something. The emotional characteristic is that you have anxiety and distress, you have guilt and disgust, you have accompanying depression. So these are the characteristics of OCD. So it's obsessive thoughts, you have insight into excessive anxiety, cognitive coping strategies. So really the key point I would definitely for sure remember is this. Definitely these two are always what you can explain it to. Because this is really quite similar to this one, if you get what I mean. But yeah, anyways. So the biological explanations, we have two types. Biological explanation is your genetic explanation and your neural explanation. This is where it really talks about, for example, serotonin. So genetic explanations. The genetic explanation to OCD focuses on identifying the candidate gene associated with OCD. So it really focuses on the gene that is associated with OCD. So it's believed that OCD is a polygenetic condition, so there's more than one gene is involved in OCD. Taylor et al. Suggests that there may be up to 230 genes involved in OCD. Researchers have discovered genes that create vulnerability to OCD, so genes that make you more susceptible to having OCD. These genes are called SERT and COMT. COMT is in regards with dopamine, and then SERT is regards of serotonin. So here, SERT gene is in regards to serotonin, and COMT gene is in regards to dopamine, as I've mentioned above. One particular variation of the COMT gene results in high levels of dopamine, which is more common in patients with OCD. The SERT gene affects the transport of neurotransmitters, serotonin. So serotonin is a neurotransmitter. This causes lower levels of serotonin to the brain, and it's associated with OCD. So it's your low level of serotonin, OCD, high level of dopamine is also OCD. So it's your low, high serotonin, dopamine. Here, so we have neural explanation, so the role of the transmitter, the neurotransmitter. So as mentioned above, we know that low levels of serotonin is associated with OCD. Serotonin is a hormone that helps to regulate mood. Research to support that low levels of serotonin is associated with OCD is Piggott et al. So found that antidepressant that increase serotonin reduces the symptoms of OCD. Really basic point, easy to add into your AO1. So Piggott et al. Found that antidepressants that increase serotonin reduces your OCD symptoms. Dopamine, remember, drugs in general can never actually fix the underlying cause. It can only fix the symptoms, which is another key point to link back. Dopamine in regards to OCD is when there's high levels of dopamine and it's been associated with some symptoms of OCD, especially compulsive behaviour. So quite what I just said a few minutes ago. Evaluations are what you need to know. So research to support that actually some genes are that some people are vulnerable to OCD due to their genetic makeup. Some people are more vulnerable to OCD because of their genetic makeup. So Nesta et al. He reviewed a twin study and found that 68% of identical twins shared OCD, and only 31% of non-identical twins shared OCD, so actually had OCD. This strongly suggests that there must be a genetic influence on the development of OCD. So I've kind of actually said your point. Also said your evidence, and it also said your explanation here. Remember, always explain what the answers, the question is asking you. For example, outline one biological explanation to OCD. Just say that, for example, in this case, you can say, this strongly suggests that there must be genetic influence on the development of OCD. Actually, where can I actually add biological? That there must be, so you can do which supports the biological explanation to OCD. Add in, even if it's this part that you're repeating in the question, add it in, because clearly you're just repeating it. It doesn't matter if you think, oh, but I've added this, it's in the question. No one cares. Add it in, because you're actually showing that you're answering the question and not just randomly talking about Ocd et al, how he found that 68% of identical twins develop OCD or shared OCD, and 31% of non-identical twins had OCD. So yeah, they shared OCD, by the way. Research support the neural model. Actually this was a evaluation point for the next part of OCD, but it shows that the antidepressants that work on serotonin are actually effective in reducing the serotonin symptoms. So this suggests that serotonin must be, I'm pretty sure this is supposed to say OCD. So this suggests that serotonin must be involved in OCD, and that the biological factor may be responsible for OCD. Again, linking it back to my question, whatever they ask me. Limitations. This is a really important point, I think. Definitely learn this point because it's great. Your biological explanations actually doesn't really take into account to your environmental factors. So there's research that shows that environmental factors does exist, and that affects OCD, and it cannot just be entirely genetic origin. So Cromer et al. Found that actually over half of OCD patients had some sort of traumatic experience in the past, and that OCD was more severe in patients with more than one trauma. This suggests that OCD isn't entirely based on genetic factors. This means it's a partial explanation for OCD. This means the biological explanation is a partial. It means...
Yeah, why?
Is a partial explanation. So again, linking it back to your question. Here, now next we're going to do the biological treatments. So SSRI, so it's your serotonin, so your selective serotonin reuptake inhibitor. Actually, I honestly have no clue. Well, I do, but it's just it's either selective first serotonin. I think it's selective serotonin reuptake inhibitor. So drug therapy aims to increase or decrease levels. It's the alter levels of neurotransmitter. Really key points, shorten up. SSRI increases levels of serotonin in the synapse because it prevents the reuptake of serotonin. So we know that, obviously, examples might pre and my post. So when this gets released, it actually prevents it being reuptaken by obviously the receptors here. So it actually allows the serotonin in some sort of way to remain in the synapse. Longer, so our drawing is not the best, but gets the point across. So SSRI increases the level of serotonin in the synapse because it prevents the reuptake of serotonin, so it prevents serotonin to be reabsorbed by the presynaptic neuron. So it prevents the reabsorption and the breakdown of serotonin. It increases the level of serotonin in the synapse. So combining SSRI and cognitive behavior therapy, since the drugs reduces the person's symptoms, this means that they engage with CBT much better. Remember, linking back, we know that antidepressants and cognitive behavior actually so the Marchitel one, where he found that there was 86% of effectiveness in those who actually had CBT and antidepressants. So if SSRI isn't effective after 3 to 4 months, patients' dose can be increased or can be given alternative drugs such as tricyclics, similar to SSRI, but with obviously much more serious side effects, for example, hallucinations, insomnia. Lastly, last point, nearly there, guys. It's your evaluations. So your strength is that there's research to support the effectiveness of drug treatment. So Sumer et al. Conducted a meta-analysis of 17 studies and he compared SSRI and placebos in treatment to OCD. However, 70% of patients who had SSRI, their symptoms reduced. So 70% of patients their symptoms were reduced who took SSRI. This supports that drugs do appear to be helpful for most people with OCD. Really, this is a quite big one, but you can still use it. It's cost effective and it's non-disruptive. Limitations. This is very important. So limitations are the serious side effects of drugs treatment, especially tricyclics. Tricyclics. I definitely did start this wrong. It says tricyclics, guys, by the way. So, for example, we have serious side effects like blurred vision, hallucination, irregular heartbeat. So, as much as drug treatment may have an effect on treating OCD, it can also have an effect of reducing the quality of life. So, it reduces the quality of life as a result of taking drugs. Maynard et al. Found that these drugs don't have a long-lasting effect because Maynard et al. Found that patients relapse within a week if medication is stopped being taken. Do you see how quick that is? Within a week. So they relapse within a week for not taking medication. This means drug treatments don't provide a lasting cure to OCD, which is quite obvious. But yeah, that's pretty much it. Thank you very much. Bye.